The Ulosca Nurs 255B Adult Health 1 Unit Practice Questions with Answers are essential for mastering adult health. It includes 300 practice questions reflecting real exam scenarios with detailed answer rationales to exercise clinical reasoning and practical application. It is a guide with real-life examples, case studies, and targeted reviews so students are ready for related exams. Designed for adult health success, it addresses both theoretical knowledge and clinical proficiency. Continuous updates and valuable resources are assured by subscription access for ongoing excellence in assessments and best care for adult patients. The Practice Question Study Pack covers the following: assess cardiac function, manage respiratory health, correct electrolyte imbalances, address hematologic disorders, treat gastrointestinal conditions, strengthen immune responses, evaluate musculoskeletal health, enhance clinical decision-making, provide patient-centered care, apply evidence-based practice, sharpen critical thinking, analyze real-life case studies, achieve exam success, boost clinical proficiency, stay updated with ongoing learning. Preparing for Adult Health 1 requires a thorough understanding of core nursing concepts, adult patient care techniques, and clinical decision-making skills. This guide provides expertly crafted practice questions, detailed rationales which are exam-focused. With the right tools and consistent preparation, you'll be ready to excel in even the most challenging scenarios. Why choose our study materials? Comprehensive and realistic practice questions. Our Nurs 255B Adult Health 1 practice questions mirror real exam formats, including multiple choice and scenario-based items, to enhance critical thinking and clinical reasoning. Detailed rationales for every answer. Understand the why behind every question with thorough explanations that cover correct answers and fundamental principles. Updated for Fall 2025 standards, all content aligns with the latest evidence-based practices and Adult Health 1 curriculum, ensuring you are prepared with up-to-date knowledge. What's included in our comprehensive study pack? Nurs 255B Adult Health 1 practice questions focused on essential adult patient care, disease management, and clinical decision-making skills. 2 core adult health concepts. Review detailed notes on prioritization, pathophysiology, nursing interventions, and care frameworks tailored to adult health. 3 real-life scenarios and case studies, practical examples that bridge theoretical knowledge with real-world clinical practice for enhanced understanding. For instance, SAMPLE cardiac function and assessment. A patient presents with severe chest pain radiating to the left arm and diaphoresis. The nurse notes ST segment elevation and leads IAI, and a VF on the ECG. What condition should the nurse suspect? A. Stable angina. B. Acute myocardial infarction. AMIC. Pericarditis. D. Heart failure. This question describes a classic clinical scenario associated with a cardiac event, asking the nurse to recognize a specific cardiac condition from given clinical clues. Question breakdown. Clinical presentation: severe chest pain radiating to the left arm, diaphoresis, profuse sweating. ECG findings: ST segment elevation and leads IAI, and a VF. ECG interpretation: leads IAI, and a VF correspond to the inferior wall of the heart primarily supplied by the right coronary artery. ST segment elevation specifically indicates myocardial injury. Analyzing options: A. Stable angina. Chest pain typically occurs predictably with exertion and resolves with rest or nitroglycerin. ECG changes usually absent or transient ischemic changes without persistent ST elevation. B. Acute myocardial infarction. AMI presents with severe, persistent chest pain radiating to the left arm or jaw. Diaphoresis is common. ECG shows persistent ST segment elevations, indicative of myocardial injury. ST segment elevation and leads IAI, and a VF specifically indicates an inferior wall infarction. C. Pericarditis, usually characterized by sharp, pleuritic chest pain improved by leaning forward. Diffuse ST segment elevation in many leads, not localized strictly to inferior leads. D. Heart failure. Common symptoms include shortness of breath, fatigue, swelling of the extremities. ECG changes are usually nonspecific, may include evidence of chronic strain, but typically not acute ST segment elevations. Correct answer: B. Acute myocardial infarction. AMI rationale: the patient's clinical presentation and ECG findings, ST elevation and leads IAI, a VF are strongly indicative of an inferior acute myocardial infarction. AMI specifically associated with occlusion of the right coronary artery. Prompt recognition is crucial for initiating immediate therapeutic intervention. Thus, the nurse should suspect an acute myocardial infarction. AMI. Mastering adult health has never been easier. With Ulosca's Nurs 255B Adult Health 1 Unit Practice Questions, You have access to over 300 exam-focused questions, detailed rationales, real-life scenarios, and targeted case studies designed specifically for clinical excellence. Enhance your theoretical understanding and clinical proficiency, stay updated with continuous resources, and build your confidence for exam success and quality patient care. Subscribe today and elevate your adult health nursing practice.